Jacob. So I'm Viveck. Nice to meet you.
My pleasure.
Can you hear me?
Yeah, I can hear you well.
Nice to meet you. So I've heard a lot from you from the community here in India, and just would and I saw some excerpts from your book talked about, and I would love to know more about you and your research and everything that you have to offer.
Well, I'm a medical doctor. I also run a health company. Therefore, I've looked deeply into topics like nutrition, supplements, etc. I wrote a couple of professional books for doctors and naturopaths on these topics. Okay. And obviously, the COVID topic causes a lot of discussions, mainly in form of yelling, panic, and carelessness. You seem to have a similar or even worse cacophonia in the US, like we have in Germany.
Right.
The topic, right. You mainly hear the weirdos from left and right, but you rarely hear reasonable, sane people and who understand the broader aspects. That means like the features of the pandemic, of the socioeconomic impact, of the psychological impact, and etc.
Right. And you recently published a book, is that correct? On
yeah. Well, I've been looking into it obviously since January, and since I have 50 people in my company, it was an essential topic to keep everything running. We had zero lockdown, but a tremendous increase in work and no home office also practically. I ordered face masks in China when Fauci and all the other guys said they're useless. We had the same misinformation in Germany, but everybody with a little brain who looked China understood and what's the right thing to do. And the scientific studies have been around for a very long time in SARS. So basically either they were stupid or they lied to us because they didn't have any face masks and were not prepared. So the public has been misinformed from the beginning to the present, and the media has played, I would say, the most disastrous part, because it basically is just panicking to the people and doesn't give any solutions except of endless articles about vaccines that are hopefully coming someday. And there's a complete lack of information regarding the immune system, how to protect yourself effectively, what you can do yourself practically to really minimize your risk on infections, and even more importantly, the risk of a deadly disease. And there's plenty of evidence that someone never makes it in the main media.
Right.
So that's basically what the book is about. It's purely evidence-based. I'm neither corona panicker nor denier.
Right.
Obviously, a pandemic we have to deal with, but in a reasonable way.
So what in your experience, your clinical experience and your research, what have you found is, like say there's 3 things that you would recommend to our patient population?
Well, if I have 3 things, let's start with preventing an infection. Obviously, it's an airborne disease. It's mainly transmitted by aerosols that linger in the air even after an infected person goes away. That's the reason why, like, religious people who like to sing a lot usually have like 100% infection rate in just one singing event. That's scientifically very well established. Especially those who sing loud produce 20 times more viruses than if you speak normally. So basically one infected can infect like hundreds of others. Let's put it like that. These gatherings and events are all super spreading events. Included.
Can you hear the singing in the background from I don't know. You can hear from Mayapur, right? The sounds from Mayapur
Nah,
is coming in. You can hear the mosques. You can hear, yeah, you can hear the mosque. You can hear the temples. You can hear everything because it's surrounded, right? And
yeah.
so interesting. Interesting.
I would say the mosque
very
singing
interesting.
on the thing is probably the most harmless because it really keeps a social distance.
That's right.
Maybe we should introduce that also in our places, you know.
Right.
But otherwise, obviously, this kind of community living and singing is super spreading events. And if somebody has it, you can't avoid that. Practically everybody who participates gets infected. We've seen that practically in many places. So there needs to be a very strong focus on protecting the risk groups. And they should definitely stay away from these events. We don't need more Bhakti Chiru Swamis and so on. And amongst these older senior Vaishnavas, there are lots in the risk group.
Yeah, absolutely.
So obviously, for healthy people, the virus is actually pretty harmless. That's why we have 80% asymptomatic people. But these are the most dangerous ones. They don't even realize they're spreading the disease. So people can be completely okay, you know, and they're the main spreaders. You've seen that in India, you know, like in the slums or in gathered, you have like 70, 80% infected people, and actually pretty not so many dead people so far in India. India is doing really well, which is not because of a great medical system, but simply because, you know, poor people in India usually work outdoors, have reasonable vitamin D levels, and also they are usually younger. So and the mild weather especially has been very kind to India. That's going to change, especially for northern India. When it's getting cold and foggy, India will experience a very, very different COVID-19. In Germany, we had the same thing in the summer. It was like everybody was like, well, all this nonsense, you know, I had Corona, it was nothing. Yeah, of course. The flu also in the summer is like not the flu in the winter. The seriousness of the disease is almost like two very different diseases. So people need to keep that in mind, that we had a nice summer break and it's going to change dramatically. And we should prepare for that also, especially in India, which so far, that's my wife, Suzanne.
How are you? How are you? You're a better half. Awesome. Very nice.
Now I'm happy I get to meet you.
Nice to meet you too. Nice to meet you too. Is Mrs. Jacob? Is that correct?
Yeah, exactly.
Yeah.
Yeah.
Okay.
Bye-bye.
Nice to meet you, Mrs. Jacob.
Suzanne.
And you are again.
I'm Viveck Baluja.
Okay.
Well, very
All right.
Very happy to meet you. I will leave you now for good discussions.
Oh, no, perfect.
So that's the start. A lot of people are not taking it serious because they've seen mild disease, which is typical in the summer and the mild season. That's going to change. The more temperature drops, it's a very different cause of disease. And the first essential thing, obviously, is masks. We've all had these, you know, that kind of textile masks that were spread everywhere now, probably also in America. There are, most of them are pretty useless. There's basically no evidence. And since everybody can produce his own mask, there will never be any evidence because you never know what somebody's wearing. One thing is sure, according to the largest Lancet study, 18-layer cotton mask, 18 layers, is equivalent to a surgical mask. So from that, you can extrapolate that the common 2 to 3 layer masks, or even not just that kind of shawl, is pretty ineffective. It's better than nothing, but it's ineffective. And people should know that. So surgical masks are pretty good. That's a surgical mask. They've been used since SARS. There is serious evidence for it. You see, however, that most people that use them in the wrong way. If you see people wearing masks, they usually wear them like this, that's the worst, or like this on the tip of the nose. That means here you have huge leeches and your protection is reduced dramatically. So the mask has to really start here, the beginning of your nose, and you need to make sure that it's tight. Otherwise, this is probably the most important thing about masks that's not considered at all and not promoted. You know, people, especially in the West, need to be educated how to wear masks. Asian people have a great advantage. They have smaller noses. So they are a lot better protected by the masks, really, and you can see it in the study.
Right.
So they have a racial advantage. So this is the surgical mask that's fine for the normal population. If you have risk factors, I think we should get to these a little later. You use KN95 or in Europe FFP2 masks. They look like this. They are tighter, and again, they have to sit up here. They have a bit better filtration, but the fitting is more important even than the filtration. So these masks really are used also in hospitals. The FFP2 is a good compromise between being able to breathe and protection. And that's the one highly recommended for all people with risk factors. You also have like masks with these filters. They are
with the
totally useless for your surrounding because you breathe out the viruses. So you're protected and everybody else gets infected. So first thing is really people need to be educated about the right masks and how to wear them. Very simple, very basic. I've been only educated to wash our hands 100 times a day, you know, not touch your face and all that stuff. But that's secondary, actually. The mask and how it works is more important than airborne disease. The other thing is not unimportant. Third issue, if you're really in the risk class, what surprised me most in doing my research was how important eye protection is. If you look in Chinese studies, you see that people with glasses like me, in China, they obviously all wear masks, have a 80% lower risk of infection than people without glasses. And also the Lancet study shows a great risk reduction by 80%, yeah. Show a great risk reduction with in the similar size with eye protection. So if you don't wear glasses, start wearing them or use eye protection in higher risk situations. So high risk situations are crowded interiors, especially in the United States are a fascinating country. They even hit record-breaking death numbers even in the summer. One major reason is that they hardly go outside but use air conditioning everywhere, which is great for the virus. Now it can be evenly spread and be democratically distributed to everybody. Also, you know, metropolitan underground system, public transportation, everything with unfiltered air and air ventilation is fantastic to get everybody infected in the winter and in the summer, and obviously in the winter it's now going to be more. Therefore, in risk areas, H13 HEPA filters help to filter out the aerosols. That's one thing that could be used. But in general, visit such locations only with a mask and try to keep it short. Because it's not now, the risk is not if you have a contact of 1-2 minutes. The risk is if you have a contact of 10-15 minutes. It's not that you're immediately upon seeing somebody, you know, the virus jumps over. But no, it can be already lingering around in a room and you just go there and stay there for an hour, then you can get it. So interior rooms are high risk areas, and the more people, the more riskier.
Especially emergency waiting rooms. You know, it's emergency waiting rooms are quite interesting places. I always wonder about, you know, the waiting rooms in emergency departments, especially here in India, because here in India, you're finding, especially, you know, you go to different hospitals, you're sitting right next to each other, but everybody's got a mask on. So there's the social distancing and they're packed, right? And not everybody has COVID-19, but I find that even sending a patient, you know, to the hospital is risky because they were feeling well before, you know, and if they're getting imaging or whatnot, maybe it's just better not to even go, you know, for some. And
Yeah.
so I'm wondering if, what about other countries, you know, if they're running, I know, you know, working in the emergency rooms in US, I wasn't able to really see all the waiting rooms as far as telemedically, but as far as seeing the ER, know everybody's distance, but you know, being able to take a real good at those waiting rooms, I've always wondered if that's, you know, a good nidus for infection.
Especially because the people there will not wear the mask correctly, and they wear inferior masks. And I've seen footage from India, and it's obvious that this mask wearing is not going to work. It is a fact that the Asian countries, if you look at the mortality in the Asian countries, I think the US is something like 100 times higher than China, Taiwan, Singapore, Japan, and a few thousand times higher than Taiwan. So basically all of the Chinese country, whatever government, doing a lot better. They have been a lot better prepared. They are prepared. And the major factor is the people are trained in being, you know, having a solidarity. It's like mask wearing has been for them natural for the last decades. Everybody who has a cold now wears a mask, not in fact anybody else. In Germany, it's more like I have a cold, everybody else should get it. And we are totally upset that we are told to wear masks. This is like our liberty is abolished and democracy is ruined because we have to wear masks. No, before the same people were always going on demonstration with masks, not will be recognized. So in the West, we have a very weird understanding of democracy. It's more like narcissism we are promoting than democracy. And that's why Asian democracies are doing a lot better. They have, you know, they will come out of the crisis like rockets, whilst the rest of the world will have to struggle for a long time. This is not Corona, this is our society. And the painful thing is that our Western societies just really have to look into the mirror. And that's really upsetting for a lot of people. So
behavior, right? And inbuilt, it always comes down, outcomes always come down to a limiting factor of the ego. So it depends on, you know, how much,
solidarity, social responsibility.
Absolutely.
And in India, obviously, you have the problem that you have so many people. In India, you basically cannot avoid herd immunity long term. People are it's so densely populated, there's no way around it. That's why the other very important point is what you can do to stabilize your immune system. I think for India, that's the key issue, because in certain settings, super spreading is just unavoidable. That's why I couldn't at all understand the Indian lockdown. I mean, it was obvious that everybody will get it earlier or later. And you better prepare how to deal with it in an intelligent way. And for a very long, should we first deal with the risk factors or with what we can, I think first risk factors and then what you can do for immunity, I think, because it's connected.
Well, before you go on, I just wanted to talk about three things that you mentioned. The first thing was the HEPA filters. What is the percentage that the HEPA filters can actually, HEPA filters, HEPA filters that you actually talk to, if we could talk about what your research talks about and your book talks about as far as the HEPA filters and your the thought process of air conditioning. Those two things, if you could just elaborate a little bit more. You talk about air conditioning being a nidus and everybody using air conditioning. I know we stopped using our air conditioning other than probably for 1 to 2 hours per day and just try to adjust ourselves. What advice do you give, you know, obviously the colder season is coming in, but for those people who are still in more hot climates, you know, in India, it still gets hot during the middle of the day.
The thing is, you can use air conditioning, but, you know, put it on, like in India, on 25 degrees, not colder. And the problem is really if you are there with other people. If it's your family, that's fine. But it's a very different story if it's a public place. Now, if you know the people there, no, it's contained. The problem with air conditioning, it's running in all the public, in all department stores everywhere. There it's where it's going to be spread. It's not in the private setting. The problem in India is when I ever was there, was like switching from 40 degrees to 15 degrees. And this is very hard. It's like you're really frozen in American and Indian air conditioning. And that's very, very hard on the mucosa and the immune system, because it's got a shock, and the blood perfusion and therefore the immunity in the mucosa of the region up to the lung is downregulated a lot, and the virus can penetrate. So that's the main reason why people get these diseases when temperature differences are strong, or if there's a drop of temperature. That's why it's called a cold. Now, if you get a cold, you can catch a cold, because every virus, if it's corona, the flu, or whatever, the rhinovirus penetrates in that setting. Avoid coils, avoid cooling off, like if you're sweating and then get into air conditioning. These are the dangerous situations. Regarding the HEPA filter, there's H14, which is filtering very effectively, but doesn't have a big air turnaround and is very expensive, and it's not necessary. You don't need to filter out the virus. You need to filter out the aerosols, which are a lot bigger. This is also the reason why masks do work, and whatever was said before is just nonsense. Of course, the virus can get through a surgical mask, but we're not after the virus. It's not like an aeroplane flying around. The virus is sitting in aerosols, and they're a lot bigger than the pores of a mask. Therefore, H13 HEPA filters are sufficient to filter out the aerosols and are the best cost-effective compromise.
What's your practice, your general practice made of? Are you a generalist? Are you dabble in naturopathy and all this? I know you're an MD.
Naturopathy general practitioner, but now running an international company in dozens of countries with 50 employees, and I'm pretty packed up. I'm not dealing directly with patients, and I'm having a lot of emails, and I'm doing like pro bono stuff, but otherwise have tons of other stuff to do, including research and development, which is like my key focus. So I have a little more distance to the daily pains of a doctor, and can take more like a bird perspective, which it's important in such a situation. That means now looking into different countries, looking really into worldwide research, and building a balanced opinion, which you very rarely find. And collecting feedback from different countries.
What's the focus and your aim of your company? I see it's research, you're researching, but what is your product, what's your product line, and how did you merge from this into COVID-19? From, obviously you said you had 50 employees.
Well, I come from a families of doctor. I'm like third generation, and I didn't want to become a doctor because I found it highly ineffective in the modern time, because it's all built on acting at a point where it's too late. The time I had to work in hospital was the most depressing and frustrating time in my life, because basically people are not really helped or cured, but like prevented from death and kept in a pretty terrible state. So my focus is really in preventing damage and helping people to stay healthy and helping people to help themselves. I firmly believe that our medical system is going to break down more and more. We can see that in Germany and in America, well, they practically don't have one anymore. And it more or less really ends up with a with everybody taking responsibility for their health. This is our most important responsibility, and ultimately we ourselves have the biggest influence on our health. Now it's our way of living and eating that is determining how we're going to spend our old age. You know, if it's going to be pleasant or if it's going to be very unpleasant. We expanded our lifespan, but usually in a quite bad health condition. We nowadays do have all the means to have a long, healthy life, but a few of us really take these opportunities, and there's still not very much really good information. There's a lot of blabber and pseudoscience out there, but it's very one-sided usually. No, it's one-sided alternative or one-sided paid by the pharma lobbies. So there's very little in between. So the biggest...
Yeah, why is there a balance?
Well, it's a good question. I really don't understand. I see myself there, and I always shake my head. I can't understand it. If I talk with people, I see the greatest need is there, but it's addressed very little. And on both sides, you find the same extreme one-sidedness and practically only half-truths. So I see my purpose there in an evidence-based approach that integrates, you know, modern science, what we know from naturopathic traditions, be the European, Indian, Chinese. Now we have a lot to learn. You know, basically the most powerful natural substances come from Ayurveda, obviously. They made their way into like mainstream. So all these traditions and modern research can really learn a lot from each other, but usually they're just never talking to each other, but yelling and polarizing, and that's it. You know, people are just like watching a ping pong game, you know, wonder what to do. And maybe this is what some people want at the end. You know, the confused person is not acting at all. And that's the worst, you know. If I think of a marketing perspective, that could be the purpose behind it of all, you know, leave the people in the hands of the trusted sources and not act for themselves and not think for themselves.
Right. No, it's always usually a trifecta approach, you know. There's especially, but in the acute setting, you know, obviously I feel like acute setting is great for allopathy, but after that, I feel that allopathy really drops off, and in the chronic setting, you often find that these other interventions may be more helpful. You know, in the chronic setting, you know, you'll have somebody who's had, you know, they'll have sort of, you know, they'll have a stroke, you need to get TPA, but then, you know, there's a limit to how much your allopathic approach can do. And then you'll find these pockets or these areas that have been unresearched, especially, you know, in India or different countries that have a completely different perspective on the human body than the allopathy does. And you see, at least anecdotally, that there may be better outcomes as far as, you know, in the long term, doing different sorts of physical therapy, using plants and herbs that are different, and, you know, those outcomes are there. So it's sort of both sides. In the addiction market, you have 70,000 people that are dying in the U.S. every year. But the talk of, you know, using meditation as a mainstream, you know, which is very well known by monks, you know, all over the world, you know, that this is a good way to be able to control your senses. It's not pushed. So I agree. There's no balance. But then also at the same time, if you talk to monks, you know, in the East, sometimes they're so averse to allopathy that it's like, okay, how can we bring all of you to the middle, you know? And so it's quite amazing, you know. So, you know, for example, we had one monk we saw, and he's got an infected tooth. He said, you know, use antibiotics, and he was like, no, I'm not going to use antibiotics. And it took me through, you know, I had to get 3 interviews with dentists, and finally he found one that he trusted, and it was the same treatment, but finally he started his antibiotics. So, you know, it's on both sides, you know, it seems So
Absolutely.
just finding that middle ground is very difficult.
It's all about psychology. Those on the extremes are the loudest and the most convinced and have the worst arguments usually. And with your analysis of chronic and acute, I fully agree. Obviously, modern medicine is great in acute things, but it still needs to learn to be integrative. You know, I think at least as many people were killed on intensive care units in COVID-19 as cured because of maltreatment. There were countries that did it great, like Portugal. They immediately understood that obviously cortisol is great. You know, if you understood properly the nature of the disease, you understood already in February that vitamin D is a key ingredient, and cortisol will be a key ingredient because it's not the virus that kills, but the hyperreactive immune system and the cytokine storm. So in other words, modern medicine or school medicine is often incredibly stupid and not very modern. Yeah. That's what strikes me also. It's like they're often very bad at their job. There's a, you know, like Trump got a really great treatment. And if you, fantastic, you also saw the outcome. And then if you read on CNN, practically everything was like demonized and criticized just because Trump got it. And well, no, you can't politicize medicine. You know, it's like, oh God, the doctors are thinking, oh, I can't use that. No, that's too Republican, or this one, or this is, and that's what's going on. It's all psychology, politics, and there's little real science and just reason. And that bothers me a lot, really, because, yeah. But otherwise, I completely agree. And I think all sides could do a lot better than they do.
Yeah, you've got one extreme in the U.S. You've got Fox, and then you've got CNN, and then usually, you know, what's wonderful about, you know, having been trapped in different countries, you kind of sometimes, you know, you'll see Al Jazeera, and it's just a great, you know, middle of the ground, you know, news channel that will just basically show both sides. It'll allow you to think for.
I usually read Al Jazeera.
Exactly.
I read CNN to see what the Democrats are supposed to think. I read, you know, I look through Fox what the Republicans are, you know, are told to think. It's really, you don't find the truth there, but you find what kind of brainwashing is going on.
Very, very true, very true. But it's I guess it's less in your face than it is in the other area. You know, it's amazing to get a whole perspective after being, you know, out of the country for a little while. So you were going to say that should we talk about prevention and preventative and risk factors?
The risk factors are very important because I've seen in Germany that the people at most risk took it the least serious often, and that's basically the problem. I think these groups need to be really educated, and if they don't comply, they need to be forced. Because they are the ones who are going to overpopulate the IC units, and those are the ones who are going to die. So what you can clearly see, the virus enters through the ACE2 enzyme or receptor. Everybody who has overexpressed ACE2 is at a much higher risk. You find it overexpressed first in hypertension. So everybody with a blood pressure over 130 to 85 is starting to be in the risk area and should be careful. A normal blood pressure is below 120 to 80. And you should sometimes measure your blood pressure under stress and not just in the most relaxed condition you are. So measuring your blood pressure is the most important health advice of all. High blood pressure is the #1 killer before smoking, and it's the most underestimated one worldwide. Main cause of stroke, heart attack, and also COVID-19 death. So hypertension is part of the syndrome called metabolic syndrome.
JNCA criteria. Go ahead, next, go ahead, metabolic syndrome.
Metabolic syndrome, well, that means increased belly fat. Now, people with that, they have high blood pressure, they have insulin insensitivity. they have even higher risk. Next stage is even diabetes. They have an even more higher risk. It's like the risk factors are multiplying then, and the risk of dying, of course. Another one is, of course, if you have lung problems like COPD, asthma, like preconditions like that, that's a problem. And obviously smoking, it's a no-brainer actually. And did I forget any?
Yeah, no.
No, overweight, no.
There was
And
one paper that was actually published that said that smoking may be protective. And
yeah,
you know,
sure.
I wonder where the wisdom finally, you know, people debunk that. But it's you know, it's a really disconcerting paper to read, especially with the flaws that came out with the paper. And so, you know, but it's quite interesting what their take was on it. But anyway, I don't.
Oh,
Wondering
that's
if
why
you read
you
about that.
definitely need some medical common sense to understand stuff. Because if you have a good statistician and a clever marketing guy, you can produce any nonsense study and put it out there. It's really easy. You just have to manipulate the data properly, use the right data. Basically, you can undermine any claim with any pseudoscience. That's why you need to sort it out, and you need some medical understanding to really separate the chaff from the husk. So smoking obviously elevates ACE2 a lot, and it damages the lung and the immune system. It's a non-brainer, and Chinese studies show that also very clearly. Air pollution, of course, and yeah, most people who have these conditions are basically unaware of them, don't want to know, or they think because they take hypertension medication, they don't have hypertension and stuff like that. So these people have definitely the risk of a serious disease up to a lethal disease. And I would like to stress the risk of a serious disease, which is underestimated and which is not in the statistics. So you can really be sick for months and sick in a way you never recover. And you really don't want to have that. People who really got it seriously, they take months and months to get back a normal lung function, normal energy levels, and so on. So, of course, there are 70-year-old people who had good vitamin D, who took vitamin C, zinc, and they, like, I know people and GBCs like that who got corona and got through it very easily. And they were also basically quite healthy and didn't have really risk factors. So there will be quite a few older people who say, corona, that's a joke. And there will be quite some who will not be able to say that because they may die from it or be sick for a long time. There's one thing which is very simple and extremely effective, which is vitamin D. Normally we can produce it in the sun. It depends very strongly on the color of your skin. Like with your skin, you will need like 1-2 hours in the sun, and a Black American will need at least a whole day naked in the sun to have proper vitamin D levels. And a Caucasian now gets in the summer within 50 minutes good vitamin D levels. In other words, either you supplement or you check your vitamin D level. For sure is in the Western Hemisphere, you can't make it in the sun starting in October. So also in India, with the huge amount of air pollution, vitamin D production will drop dramatically. In the winter, I've practically never seen the sun in Delhi or in these places. No, it's like the winter in Germany. It's mainly fog, and you see like 10 meters. So there's zero vitamin D production under these circumstances. So not theoretical sun, but real sunlight. That's what I mean. Vitamin D is shown in many studies now that it works very well. There have been supplement studies in ICU units with vitamin D, double blind studies. One group got high dose vitamin D in the ICU, the other group didn't. If I remember right, like of the group supplemented, it was like one person who had to go to ICU from normal stage, And in the unsupplemented group, it was everybody. It was a difference of factor 13. 13 times more people without supplementation ended up in ICU. Spanish study. You have a lot of studies from Asia that show the same thing. Indonesian study shows that 20 times more people with vitamin D levels below 75 nanomoles per liter died from COVID-19 or had a almost deadly disease 20 times. So the normal argument is vitamin D is a confounder. In this and many other studies, that was, of course, taken into account after statistical corrections of these confounders. A lack of vitamin D was still going together with a 10 times increase of mortality. So 10 times more people died. Why? After eliminating old age, sex, and risk factors. There are many, many other studies.
What is it with the vitamin?
What is what? Well, vitamin D.
What is it that vitamin D does? I mean, is it the calcium? Is it?
Well, vitamin D.
What's allowing our immune system?
It does many things actually. It interacts with practically hundreds of genes. It's one of the most important immune regulators. It also regulates ACE2. So if you have a lack of vitamin D, your ACE2 is upregulated. But it's like it's not strengthening your immune system, but it regulates it. It's essential for the activation of CD8 T cells. So practically your immune system cannot get started if you don't have enough vitamin D. And that's the problem, what you can see with all people with problematic disease. Their immune system tries to react, but can't. There's no specific immune response, but instead, the other side overreacts dramatically, the unspecific immune response. I usually compare that with the American War of Terror. So the original approach was like, bomb everything back to the Middle Ages, and that's how you stop terrorism. That's more or less what's happening, what the immune system does in these people. They destroy themselves. What a healthy immune system does, it targets the terrorists, really, it really attacks the virus and the virus-infected cells. Specific, unspecific. So, and the difference is obviously life and death, because we know now very clearly that it's that cytokine storm that's so deadly, and we know for a long time that vitamin D helps to ameliorate cytokine storm. We know that already since flu and other viral infection. That's why there's a large meta-analysis on double-blind studies with 11,000 patients that were supplemented with vitamin D. And it's shown that people who had a lack and got vitamin D reduced their risk of serious pulmonary disease by 70%. So this is all really highest medical level. It's a WHO recommendation for a long time for respiratory infections, and after all, COVID-19 is it. It's also respiratory infection, and there's plenty of evidence directly with COVID-19, so strong that the British government changed their opinion and now wants to give away vitamin D free to everybody. They had a change of, not of heart, but of mind after really understanding the evidence.
Where was this? Where are they giving it?
Great Britain.
Is this?
Great Britain. I mean, Israel has been doing for quite some time. Yeah. The French Medical Society said the same thing in May. I'm saying it since February in press releases. It just takes the other guys a little longer, but the evidence has been around for the masks and for vitamin D. And it's actually a non-brainer. It's not understandable why there's so much still propaganda against it. In the proper dosage, it's a very safe thing. Proper dosage is 4,000 units, which is 100 micrograms per day. This is the recommendation of the American Geriatric Society for everybody above 70. That's safe. I'm not recommending super high dosages for vitamin D. They can be dangerous. But if you have, if you got corona, you can take like 10,000 units for some days or for some weeks. That's also safe, but not long-term, obviously. But even long-term, 4,000 units are safe unless you have certain preconditions. And if you take too much calcium, of course, it could be a problem. Usually it's not the vitamin D that causes the problem, but it's that people take too much milk products and calcium. All vitamin D problems are caused by calcification, not by the vitamin D itself.
So you feel that you're a strong proponent of vitamin D. So supplementation. I just had 2 patients that I saw. Both of them, one of them started having memory problems, and the other had restless leg syndrome. So we ordered their vitamin D levels, and both of them came back. And it's amazing how often do you get 15 minutes of sun per day? Especially in Germany, do you get that?
The Indian middle class never, and the upper class also, because they never go out.
Mm.
So
right.
India is the richer part of the Indian population has usually very low vitamin D levels unless they have good doctors. Therefore, India has, I think, still the highest mortality and cardiovascular disease worldwide.
Right.
They have now the money to eat unhealthily, but they don't have the proper treatments and then enough proper medical care to deal with the side effects of it. That will continue to rise also now, especially since Asian people or Indian people are not really built to deal with that amount of junk food like Western people have been accustomed to by now. It's like the Western pancreas already had to endure a lot more stress during the last decades. So you get a lot more diabetes in India than we with the same lousy dietary habits. So in other words, don't copy the best, you will die earlier than we.
Fair enough. So we have the masks, we have the ventilation system, we have the HEPA filters, we have vitamin D. So I've got three major hits from you. Any other thoughts as far as your book is concerned? And I know you sent along your book. Is there a way that somebody can download it and purchase it as far as your findings in COVID-19 and your research is concerned?
They have it. We have it we sell it in Germany, France, Poland. The English translation is really substandard, but it's enough to get an idea. I provide it for free. It's more that, but don't blame me for the translation. I didn't do it. We did it mainly to help others in the English-speaking countries, but you could provide it for free and.
Is there a link?
For the English,
is there a link that we can?
It's a good idea. I could maybe put somewhere a link. We haven't done it so far. Really, I do see the need.
Nice. It'd be nice.
I would appreciate actually if you read the book before and say how bad the translation is. If you'd say it's tolerable, then I can make a free download link.
I read some of the parts, and I was like, especially Dr. Suki and I. We read through some of the parts, and we actually made some changes as far as vitamin D and making sure that we reinforce it. We would always say, especially for patients with COVID-19, that we would start off saying, okay, well, we're going to put them on the azithromycin if they're having a cough, and then we would also add C, D, and E. Yeah. And then in addition to that, the HCQ was off again and all that stuff. So it comes in, comes out. So it's really equivocal. But the vitamin C, D, and E is not something we really stress so incredibly. And then there's always some Ayurvedic therapy that's being added as an adjunct in India. So we try to go through and make sure that we're balanced in our approach, because otherwise, if we're just one stream, they'll throw us out. So the thought is that, how do you balance these things with the vitamin C, D, and E? But oftentimes those C, D, and E vitamins, they're not stressed enough. So we started stressing it a little bit more in our community ever since reading your paper. and your thoughts. So so I just was wondering if it's down for a download and whatnot. And so.
Well, I'm aware of all the other things, of course, like
So that'd be nice.
not to mention selenium. That's also an important thing, at least here, very important for the immune system. I'm just really stressing vitamin D for one reason. It's probably 10 to 100 times more important. That is really what the research shows. So if you do one thing, and if you give one thing high dose right away, if somebody with a COVID cough comes, it's vitamin D. So in the book, I could have added hundreds of other stuff with, possible effects and so on, but nothing is nearly so cheap and effective as vitamin D. That's the only reason, really. And what people often lose really in the present situation is the overview and the priority. They get confused. And I think vitamin D is very interesting for India also because it's so cost effective. And you can just load them up, and like even after infection, you can directly affect the course of the disease still when they got infected. But about then, it's really in time to load them up and then keep them on a good level. I think in India, you won't find anybody with high levels of vitamin D.
Right.
That's extremely unlikely.
It's amazing. Constantly. I was really amazed to see, but these monks, these two monks, I was amazed to see this because yes, they're serving throughout the day, but the sun is out in India, right? And it's not like it's Detroit. Detroit, your vitamin D levels go down. I've lived in Detroit. We didn't see the sun for 5 years. That's one thing that's there, but India is sunny. So I was wondering, why is vitamin D level low? So I, in my N of 2 with these patients especially, but then with my I've had some 20-year-olds that have just been coming in, and we're checking their vitamin D levels, and also low. So quite interesting.
Yeah. I mean, there are a lot of studies that show that. I've seen that in India for a long time. But if you knew Indian habits, you know why vitamin D is so low. People in very sunny countries usually avoid the sun, unless they have to, because they are like people on a low salary job. So the slum dwellers probably have better vitamin D levels than the whole Indian middle class. That's why they're also getting through the crisis pretty well. So at more risk is the Indian middle class. They have usually the cardiovascular risk factors. They have extremely low vitamin D. And they live in very crowded areas. So for them and for those in communities, it's the most effective measurement. And since I'm still pretty convinced that masks will be medium effective in India, it's probably the most important thing, starting like in November, December up to March. And if they don't go out in the sun then, the whole year. Vitamin D is known in large studies to decrease general mortality and many, many other things. I just focused on that one thing.
What about the Spanish flu? Was there any connection in the large, numbers? I mean, I was reading some articles that it could have even been up to 50 million people that had passed away, or even 75 million people that had passed away in Spanish flu in 1918. My question to you is what was, was there any studies as far as vitamin D back then, as far as anything in the literature that that could have prevented?
Then it's an interesting question. Since they didn't measure vitamin D back then, there cannot be any studies. But there are hundreds of studies on vitamin D and the flu. That's why I knew in February that vitamin D is going to work, because people die from the flu basically from the same reason, cytokine storm. It's not that we have a terribly new disease that's so different from everything else we've seen. The only difference is the ACE2 receptor. So it targets less the young people, but more the old one. The Spanish flu killed everybody, and even more the young people. But the cytokine storm is usually the deadly part. And that's just what vitamin D counteracts. And that's been known for a long time. And dozens of double-blind studies show that. Let's put it simply, the evidence on vitamin D is a lot stronger then the only licensed, COVID drug, which has a very thin evidence, which you also can see in this stock course. So vitamin D is just too damn cheap to be promoted widely. It will only be done by countries that are really desperate or cost effective. And I think India will, Modi is a pragmatic man. If he sees the signs, they would look into that. Now, they also didn't abandon hydroxychloroquine because the Americans say, it's terrible. So poorer countries will act more decisively when they understand the need.
Well, it's amazing. Modi has implemented, I don't know if you've read about this, but Modi has implemented free care, telemedical care for all the elderly, 65 and above for all of India.
I think that's
phenomenal.
Great.
It's a phenomenal move by Modi.
And I mean, long term, he's really doing a lot of good things. And the lockdown, I think, was a mistake. But I think he has the best intentions. And India will get out of that ultimately quite well. Also, your pharmaceutical industry is very important to the whole world. Basically all our medicines are coming from India and China. Europe and America has a high nose, but that's about all. Actually, you bypass Germany in medical publications, and China bypassed the US. So
right.
Yeah.
Right. Well, Dr. Jacob, it's been a pleasure to speak with you. I look forward to keeping in touch, talking to you about our patients as we go through this, and seeing, especially, for our critical patients, to see if we can implement, but more preventative, especially in our community that's here, to see if we can really start reinforcing vitamin D and seeing if we see a change in the outcome, especially as disease length takes place.
And
I think things that we do see is, look, there's not enough ventilators here. There's not, the thought process. Getting Remdesivir in the hospitals is difficult. Getting plasma is just like pulling teeth. And then, it's a difficult thing, so, if we can use it as a preventative, it'd be phenomenal, if that can really help. Obviously people are going to get COVID. And I feel that the numbers are a lot higher.
It was interrupted, but
I feel that our numbers are definitely
they're very high. They're a lot higher than known. I think you will, by next summer, you have herd immunity in India pretty much. I mean, that's the point, that the number of really infected is 10 to 20 times higher than the statistics. What I didn't mention is the cytokine storm and the hypoxia triggers microcoagulation. So the people die from microstroms in their veins. That's the main mechanism of death. That's the reason why heparin is so extremely important and so cheap. It's next to cortisol in advanced cases, and also vitamin K in terms of anticoagulation in higher dosages. But that's something which is very cheap and can be done in India easily. You have to get the people before they need a ventilator. The ventilators often do a lot more damage than saving people.
Yeah, it's that, and even the hospital systems themselves say, once they get to the actual ventilator, you got this 15%, real survival rate, and then, yeah, it's very difficult, when a patient actually goes to that level of
the people don't suffocate. No, that's not the thing. They you need to treat the underlying things that are happening there, and we can do that now really well. With the proper protocols, you could save most of the COVID patients. Also with pretty low cost things. Yeah. And what I wanted to mention is really educate the risk groups. They really need to understand and need to be educated, and they need to comply, because otherwise, the medical team needs to correct their negligence.
What about the immunocompromised? So I've read some studies about the immunocompromised that it's quite interesting that they actually may fare better than those that are immunocompetent. And the whole thought process of ARDS and it being a cytokine storm comes in there.
Yeah, obviously.
And all that stuff. And
this only confirms what we said before. We are not killed by the virus. We are killed by our reaction to it. And that depends on our immune system and our general state of health. Like kids, no, for them, it's often not even a cold. So let's put it like that. If it can, in doubt, better no immune system than a falsely reacting one. Which is always in life. Now, you don't do anything than you do something really stupid.
True. Learn that the hard way.
Yeah.
Well said.
But I'm very happy that there are people there, and that's great.
Yeah, no, pleasure, and we appreciate all of your involvement, here in Mayapur and your support of Mayapur and whatnot. And it's been a pleasure getting to know you over the last hour.
One practical thing, we sent some vitamin D for a couple of thousand of people to India. You just need to find bottles and pipettes to dilute it. Then you can easily supply everybody in Mayapur. So
perfect. So have you sent along the supply? Is that correct?
Yeah, we sent the supply. You need to get the bottles and then so that it can be distributed. It's the raw material. You can be easily diluted with plant oils, and then you have the ready product and fill it into little bottles and distribute it to the people.
Okay. So, basically, usually they come in these sachets. We have these sachets that we're getting, and then we have somebody sent along these bottles, but they don't have any label on them. They sent along the bottle, so I was.
What we are sending is the pure
little brown bottles, and I'm
wondering where they came from. We are not sending any bottles. You have to get them in India. We are sending the pure German raw material. I will tell you how to dilute it, and then you prepare. I mean, you have your little fillings and everything in Mayapur. There's a lot of people, and you just label it, and it is. A problem with tablets and sachets is that vitamin D is a fat-soluble vitamin, and it's better absorbed with fat than as a tablet. And you need to get your at least 3,000 to 4,000 units. Very often it's under dosaged in the normal things, and people don't get how much they should take. So
if you could send along some of those, if you could send along some of the bottles that you sent to the MCH and whatnot, I'd love to take a look, or just send me some pictures.
I can send you pictures of our thing. Send you by email later on.
Yeah, please. Send me. Absolutely. I think that some of those bottles are definitely in MCH, but I just want to make sure in the actual pharmacy, but I want to make sure that they're actually yours, and then we'll go ahead and distribute those. So we appreciate it. All right. Thank you, Dr. Jacob. I appreciate it, and we'll try to use that as a practical thought process, and then see if we can also measure some outcomes, with our patients, because that's really the key.
Well, yeah, and in Mayapur, everybody
when it comes down to it is if our patients feel better,
you will.
No, absolutely.
The effects are there very strongly.
Anything that we can do.
We've been, we've sold probably some millions of bottles by now, and we know that it works, and it works often dramatically. So, and in vitamin D3, K2, we are the #1 in Germany and in other countries. So we've been in that thing for a long time, know the raw material and the science behind it. And yeah, I think your study on, didn't hear you.
How long have you been in the vitamin D3 market? So go ahead. How long have you been in the vitamin D market?
With vitamin D, we started in 2000, and since 2010, we have that vitamin D drops, which are very easily dosable and absorbable. So we were amongst the first in like oil-based vitamin D drops, and for 5 years in D3, K2, we were the first with that. K2 is interesting because in higher dosages, it works against coagulation, and in the Netherlands, there are now clinical studies. It's well documented that people with COVID have very low vitamin K levels because it gets used up in coagulation processes.
So so it's a vitamin D K2, vitamin D3 K2. What does the K2 stand for?
Vitamin K2 is like MK7. Yeah, K2, vitamin K2. There are very different kinds of vitamin K, and K2 just has a much better and longer bioavailability than K1, which you get from eating green leafy vegetables. So it stays 3 days in your blood, and it helps to remove calcium deposits a little bit. And it really helps with normalizing blood coagulation in the right dosage in COVID. Like low vitamin K is used for blood coagulation, and higher levels are used for anticoagulation factors. Body is always about balance. So a lot of things have like ambivalent effects. Also like vitamin D, very high dosages are strongly immune suppressant, for instance.
Interesting. Interesting. So very high levels of vitamin D are actually immunosuppressants. So it's all about, it's all about regulation.
It's all about balance. Extremes can be used, but you need to know what you do. Then extremes can be used in treatment by somebody who knows what he does. And that's not like for everybody then to do. I only differentiate between like good doctors and not good doctors. And good is like 1 in 100 or 1 in 1,000. I'd say very good is 1 in 1,000 in Germany. So it's quite rare. And there are very few doctors I would go personally to for myself. Very few.
For yourself.
That was one advice from one advice from my father as a medical doctor: study medicine to protect yourself from the doctors.
That's great.
He was right.
That must have been
You know what I'm talking about.
Oh, I do. Absolutely. Absolutely. It's that's why they call it a practice. All right.
All right.
Pleasure. All right. So yeah, if we can follow up, I'd love to see more of the vitamin D3 K2 and the bottle, and see how we can use it for patient population.
Sure.
Thank you, sir.
I'll send you. All the best. Stay well.
Okay.